Acute renal failure may be caused by problems in the kidneys themselves, but could also result from a wide range of other disorders and conditions that occur elsewhere in the human body. Before discussing acute renal failure causes further, let's take a moment to define exactly what acute renal failure is. First of all, the term renal is a medical term that characterizes anything related to the kidneys. Renal failure occurs when your kidneys suddenly and unexpectedly become incapable of performing their normal functions, which include filtering wastes, toxins, and excess fluids from your blood. Now, typically, renal failure happens when your kidneys become irreversibly damaged by injury or disease. It may also happen if blood flow to the kidneys is blocked or obstructed from some reasons. And it can occur when waste filtered by your kidneys cannot be excreted through urine and begin to accumulate in your body. Acute renal failure is a life-threatening medical emergency. Acute kidney failure can occur in a very short period of time due to one or a combination of causes, including kidney infections, a blood clot in the veins and arteries in or near the kidneys, an accumulation of cholesterol that blocks the flow of blood to or in the kidneys, lupus, an autoimmune disorder in which the immune system attacks your own tissues, scleroderma, another autoimmune disease that affects the blood vessels and connective tissues, certain drugs and medications, including some chemotherapy drugs, antibiotics, and dyes used in imaging tests, certain kinds of cancer, especially multiple myeloma, substances like cocaine and alcohol, environmental substances, particularly heavy metals. The following are diseases and disorders that block or obstruct blood flow to the kidneys: sudden blood loss, heart attack and heart disease, infections, liver problems, especially cirrhosis, severe allergic reactions, severe burns, extreme dehydration, vasculitis, which causes swollen blood vessels. Certain medications may also block or obstruct blood flow, including blood pressure medications and non-steroidal anti-inflammatory drugs known as NSAIDs. Examples of these include aspirin, ibuprofen, and naproxen. Obstructions that block urine excretion include kidney stones, certain forms of cancer, especially bladder, cervical, prostate, and colon cancers, blood clots in the urinary tract, prostate problems in men, especially BPH, damage involving the nerves that control the bladder. Treating the causes of acute renal failure is the key to success. But the unfortunate truth is you cannot live long if your kidneys don't work. This is why acute renal failure is a very serious medical problem. Diagnosis must be made and treatment administered quickly. Treatment usually requires a hospital stay. Doctors will administer medications and fluids to restore chemical imbalances, but in some cases, kidney dialysis may be necessary. In extreme cases, where damage to kidney tissue is extensive and irreversible, a kidney transplant may be needed.